Intravenous therapy is among the leading forms of treatment in pre-hospital and hospital settings. In some cases, like cardiac arrest, IV therapy is needed to assist in getting the heart working again. In order to do so, the provider must be able to obtain the access, which the provider must be competent in order to do so. Gaining IV access is a vital link between the sick patient and fast treatment. To help everyone become familiar with IV therapy, I will explain the history, show you how to implement it in the field, and demonstrate the use of the IV catheter. First, I will give some insight on the upbringing of IV therapy. IV therapy dates back to the 1600s, back in the Middle Ages, where they used quills and animal bladders as instruments, which is around the cholera epidemic in the 1800s. Dr. Thomas Latta implemented IV therapy and IV saline infusion. In the 20th century, two world wars established a role for IV therapy as routine medical practice. Now that you're familiar with the history of IV therapy, I will explain how it is used today in today's healthcare. It's used in pre-hospital and hospital settings. There's the regular peripheral IV, which is for short-term IV therapy. There's a midline peripheral catheter, which is mainly hospital use and can be up to 20 centimeters long, and it's used in the AC or upper arm vein, and it's for 1 to 4 weeks duration. The central cath is also a hospital catheter, and it's for a long-term use up to 6+ months, as well as the PICC line, which is known as a peripheral inserted central catheter. I will now demonstrate the use of it. The materials used, you would use a tegaderm, the actual IV catheter, a ChloraPrep, which is chlorhexidine and alcohol mix, a port, a tourniquet, some tape, definitely need your PPE, and a 4x4 gauze. At the end of this here, you see a saline flush that I implemented to help demonstrate how to start an IV, but this is also another thing that you would use. Okay, so you would want to place the tourniquet approximately 4 to 6 inches above the site that you would use. So if you were to start right here, it probably, would be about to the end of this here. Once you place the tourniquet, place it pretty tight and wait for the blood to accumulate within the vein. While you're waiting, you'll open up this package for the ChloraPrep, and you'll prep the site to clear all the bacteria away from the site to prevent infection. You'll wait 1 to 3 minutes, depending on how hairy the patient is, for the area to dry. And then you'll grab your catheter. These catheters, you want to, what we would call, break the seal. So you want to pull back just a little bit until you kind of feel and hear a little pop, and push it all the way back. Once you ensure that, you'll take this up, and when you find your vein, you'll kind of feel for it, and it'll feel kind of bouncy. Once you find your vein, you'll go at probably about a 45-degree angle, and you'll insert it in the vein here until you see a little flashback. Because this is a demonstration, you don't see the blood return as you would on a normal patient. But when you see that flashback, you'll insert both the catheter and the needle slightly, and then you'll flatten it and insert the catheter, and you'll stabilize it with your thumb, pull back, and you'll see the blood return through the catheter. And once you do that, once you see the blood return at the end of this hub, you'll clamp the seal, you'll open up your tegaderm here, you'll place it above the IV site, and depending on whether you need to draw blood or just flush the site, you'll have your saline flush or your syringe, and pull back on blood if needed. Then you make sure you flush the line and just time and date it, and that is good. The trick to successful IV access is repetition. Also, it is important to take your time and let gravity be your friend. Typically, I like to use 2 tourniquets. I'll hang the patient's arm down. Depending on the vascular access, it'll take a little bit longer for the blood to accumulate in the vein. So I would wait about 2 to 5 minutes. While you wait, you can get all your materials ready. And 98% of the time, I've been successful in gaining access. Now that you know the history, the different types of catheters, and the demonstration, hopefully if you guys are going into the healthcare field, this will help you gain access to make your patient healthier. Thank you.